dental buds erase, which form enamel organs, and enamel organ finally will give rise to the enamel of the tooth, which covers the crown of the tooth, and the cuticle, which covers the enamel from the outside, but mostly it is erased, and it still is present on the lateral surface of the tooth. Neuromesenchyme gives rise to the dentin in the both crown and root, and also the pulp of the tooth, which is inside the tooth, and cementum, and also periodontal ligament. Now we will discuss tooth development in details. Here you see the stages of development. They have their specific names. So first stage is called dental lamina, then dental bud develops from the dental lamina. Here you can see the oral epithelium. It proliferates and invaginates, goes down into underlying mesenchyme to form first dental lamina and then the thickening on the dental lamina, which is called dental bud. Next stage is called enamel organ, because the dental bud proliferates and forms the specific structure, which is called enamel organ. And enamel organ has two stages, cap stage and bell stage. And then we will have the histogenesis of dental tissues. Histo means tissue, genesis means development. So during this stage, the tissues of tooth start to develop. It means that enamel starts to be produced and dentin. And also the pulp develops, and next we will have the root formation and the cutting of the tooth, the teething. Milk teeth start to be formed starting from the second month of embryonic development, and their teething starts on 6-7 months after birth. Permanent teeth start to develop also during embryogenesis on the 4th month of embryonic development, and they start their teething when they go to the oral cavity, starting from 6-7 years of life of the child. So, stages of tooth development include first dental lamina, invagination of the oral epithelium into underlying mesenchyme. Next, dental bud in the end of the dental lamina. Next, enamel organ, cap stage, during which tooth germ morphogenesis happens, and bell stage, or cytodifferentiation, when the cells of the enamel organ become those cells which will next produce the tissues of the tooth. And these cells are called ameloblasts and dentinoblasts. Ameloblasts will produce enamel, and dentinoblasts will produce dentin. Next, we have histogenesis stage. During this stage, we can see the tissues of the forming tooth, the enamel, black line in this picture, and dentin, gray line in this picture. And after all, the root formation happens. The root develops later after crown, just before the teething of the tooth. During this stage, the dental root development, cementogenesis happens, and also development of the periodontal ligament. So first we have the dental lamina. During this stage, the epithelium of the oral cavity proliferates, invaginates, and forms two lines which go along the jaw in the horseshoe shape, like this. You see in this picture the lateral view, and this is the section on the side view, and this is the front view. So this will be forming lip. Here it is. It will be here in this picture. The first invagination is called buccal labial sulcus. It will form the vestibular plate, which later develops into buccal labial sulcus, and it will form the vestibule of the oral cavity. Vestibule is the small space between the teeth and the lips. So this space is called vestibule, and it starts to be formed here in this picture. And second invagination is called dental lamina. It is here in this picture, and here in this also. So this is the invagination of the epithelium as the result of proliferation of the cells into underlying mesenchyme. Next, dental lamina goes along the jaw, both in upper and lower jaw, and then from the dental lamina, which is here, 10 dental buds start to be formed in each jaw. Dental bud is this thickening at the end of the dental lamina. So developing fetus, developing baby will have 10 buds in each jaw, one bud for one future tooth. So dental bud forms as the result of proliferation of epithelial cells. And also during this stage, some part of mesenchyme also starts to proliferate and surround the developing dental bud in this area. In this picture, we see the frontal section of the head of the embryo. So this is the developing oral cavity with the developing tongue. So here will be upper jaw and here lower jaw. And in the upper jaw we have the dental lamina. It is here and on the opposite side also. But in the lower jaw we have the tooth germs at next stages of development in the stage of enamel organs. Another example of such picture, here just opposite in the lower jaw we have the tooth germ at the stage of dental lamina or dental bud stage, and on the upper jaw we have the tooth germ in the stage of enamel organ. So after bud stage we will have the enamel organ, the cap stage. What happens? So the bud starts to be invaginated in this region because of the proliferating mesenchyme. Mesenchyme, which surrounds the enamel organ, it is here, it proliferates and pushes the dental bud from the lower part and forms this invagination. So now we have the specific structure of the enamel organ. And enamel organ consists of the outer enamel epithelium, it is here, and on the opposite side also the inner enamel epithelium, it is here, and what is between the outer and inner, it will be called the pulp of the enamel organ or the stellate reticulum, and also here we will have the intermediate epithelium. All these parts of enamel organ are the epithelial tissues because they all develop from the epithelium of the oral cavity, with which they still are connected with the neck of the enamel organ here. The tissue that surrounds enamel organ is mesenchyme, It is condensed mesenchyme because here the cells of mesenchyme are very close to each other, and this mesenchyme will form the so-called dental sac. It is here, it surrounds enamel organ, and this will be called dental papilla, the mesenchyme which pushes into the enamel organ from below. So now the red color here is for enamel organ. It will give rise to the enamel of the mature tooth and the cuticle of the mature tooth. Dental papilla, which is yellow here, will give rise to the dental pulp and the dentin in the mature tooth. Dental sac, which is green here, will give rise to the cementum and periodontal ligament. So here we have dental lamina. From dental lamina goes the neck of the enamel organ. Here we will have outer enamel epithelium, inner enamel epithelium, intermediate enamel epithelium, stellate reticulum, or the pulp of enamel organ. All these parts, the parts of enamel organ, consist of epithelial tissue. Next we have dental sac. It's the neuromesenchyme, and dental papilla, also neuromesenchyme. Next stage is called Bell stage. During this stage, the connection of the enamel organ with the oral epithelium is almost cut off in this region, and the cells of the inner enamel epithelium start their cytodifferentiation into enameloblasts. And the peripheral cells of the dental papilla will start to differentiate into dentinoblasts or odontoblasts, the cells which will give rise to dentin. Here, number 5 in this picture, this is the stellate reticulum, or the pulp of enamel organ. Here you see that epithelial cells change their shape to the stellate. They look like small stars, and they resemble mesenchyme cells because now they have very large spaces between them, between the cells, and these spaces start to absorb a lot of water with glycosaminoglycans and dissolved nutrients, because this part, the pulp of the enamel organ, will next perform the nutrition for enameloblasts, the cells which will produce enamel of the tooth. So here we see this enamel organ at Bell stage at high magnification. So here is the outer enamel epithelium on both sides, and here also outer enamel epithelium. Here is the inner enamel epithelium with a patch of cells which is called the enamel node. It determines the shape of the tooth crown. Here we will have the intermediate layer and stellate reticulum, or the pulp of enamel organ. See the shape of the cells here. They are still epithelial cells, but they look like mesenchyme because they have long processes and a lot of spaces between them. These spaces are filled with water with nutrients. We have no blood vessels inside enamel organ. Blood vessels are located outside in the mesenchyme. Below the inner enamel epithelium, which lies upon the basement membrane, white area here, below it we will see the dental papilla. This is our histological preparation. It is called tooth development early stage, but actually it is the stage of enamel organ, actually the Bell stage, because here you can see that it will lose its connection with the oral epithelium very soon, and here the cells of the inner enamel epithelium will differentiate into enameloblasts. They lie upon the basement membrane, the white line here. Just below this line, we see the peripheral cells of the dental papilla, which are very condensed cells because they lie very close together. They will form odontoblasts, and the central part of the dental papilla is more loosely packed. It will form loose fibrous connective tissue of the pulp of the future tooth. This is the stellate reticulum, the pulp of enamel organ, epithelial cells with spaces with water and nutrients. Outer enamel epithelium is here, and from the opposite side here in this area it is continuous with the inner epithelium. It lies upon the same basement membrane, and enamel organ is surrounded with a dental sac. It is here. It is the condensed mesenchyme, because here the cells lie very close to each other, unlike these areas, for example, where mesenchyme cells are not very close together. So here we have mesenchyme with blood vessels, and here you see the direct osteogenesis, the formation of the bone of the alveolus. And this is the hyaline cartilage, this is the Merkel cartilage, which navigates the growth of the developing jaw bone. So, during the Bell stage of enamel organ, cells of the inner enamel epithelium start to differentiate into pre-ameloblasts and then into ameloblasts. The cells will produce enamel. The most peripheral cells of the dental papilla start to differentiate into pre-odontoblasts and then odontoblasts. And also permanent tooth germ starts to develop from the same dental lamina close to this decidus milk tooth. So the permanent tooth germ will develop in the same bony socket as the milk tooth. So here we have the permanent tooth germ. The lateral lamina, the neck of the milk tooth, will degenerate, and next the developing milk tooth will detach from the oral epithelium. And now we will discuss the cytodifferentiation of pre-odontoblast and pre-ameloblast. So all this process starts from the top of this area. This will be the top of the tooth in future. So here all starts. What we see here? We see here the inner enamel epithelial cells. Here they are. They lie upon their basement membrane. It is located here, white line in the picture on the left. And the cells of the dental papilla just below this basement membrane are these cells, the cells of peripheral layer of the dental papilla. So what happens here? The cells of the inner epithelium of enamel organ produce and release some biologically active substances, BAS, and these substances go through the basement membrane and act upon the peripheral layer of the dental papilla cells. So these substances act upon these cells. As the result, these cells here start to differentiate from mesenchyme cells into pre-odontoblasts. So here we have pre-odontoblasts. Then they continue to differentiate into odontoblasts or dentinoblasts and start to produce predentin, the yellow in this picture, predentin. Predentin is composed of organic substances, of collagen and other proteins, and then predentin is mineralized, calcified, and becomes hard tissue. And now the diffusion of the nutrients to the cells of enamel organ is blocked because of produced here hard dentin. Now the cells of the inner epithelium of enamel organ cannot receive the nutrients and oxygen from the blood vessels of the dental papilla, and it forces them to differentiate into pre-enameloblasts and then into enameloblasts. During this differentiation, they change their polarity. It means that at first they had the basal pole where they had the basement membrane here. But now they will have their basal pole more closely to the intermediate layer of enamel organ here. And they start to form the basement membrane here, and now they will get the nutrition from the stellate reticulum, which is light area here. So nutrients diffusion now happens from the opposite side. And now the enameloblasts start to produce enamel. So they develop rough endoplasmic reticulum and Golgi complex and start to produce the organic substances which calcify very fast and become the enamel. And enamel is released towards the dentin. So enamel in this picture is blue in color and dentin is yellow in color. And here we will have the dentin-enamel junction. And while this process continues, the cells enameloblasts will go further and further from odontoblasts. So first they were in close contact with each other in this picture, but when they start to produce enamel and dentin, they gradually move from each other, while the thickness of enamel and dentin increases. So this is the beginning of the stage of histogenesis, because now we see the formation of the tissues of the tooth, enamel and dentin. And while enamel is produced, the cells, enameloblasts, have their TOMS process through which they release the organic materials and the calcium salts, which help very fast mineralization of enamel. And while dentin is produced by dentinoblasts, dentinoblasts also have their processes, but their processes are embedded inside the layer of the dentin. So processes stay inside the dentin and the cell bodies move downwards. So here at the end of the bell stage, the future shape of the crown is determined with the help of the enamel knots. The red asterisk here and here. So if we have one node like this, we will have this shape of the crown, like in the canine teeth. And in this case, we have two sides where the production of enamel and dentin starts to happen, and next we will have this shape of the crown, like in the premolar tooth. And now we will discuss how the cells change, how mesenchyme cells turn into odontoblasts, and how the cells of inner enamel epithelium turn into enameloblasts. So first about the odontoblasts or dentinoblasts. So they develop from the peripheral layer of the dental papilla, where this red arrow points. So here we have the mesenchyme cells, which are located just below the basement membrane of the inner epithelium of the enamel organ, this line here. So when they receive the biologically active substances through basement membrane from the inner enamel epithelium, they start to differentiate into pre-odontoblast. During this stage, the mesenchyme cell loses its processes, becomes more round in shape, then it becomes larger and elongates because a lot of rough endoplasmic reticulum and Golgi complex starts to develop there. And now the cell, pre-odontoblast and odontoblast, starts to release the organic substance of the future dentin. This organic substance is called pre-dentin. It is released through the apical process, odontoblastic process, which is called Tomm's fiber. And while the dentin is gradually produced, Tomm's fiber, or the process of odontoblast, stay embedded inside the layer of dentin. So first of all, the pre-dentin is produced, which is non-mineralized substance, and then it is mineralized and becomes the mature dentin. So odontoblasts have a lot of rough endoplasmic reticulum, Golgi complex, and a long apical process, or a Tomm's fiber. It is branching, and it goes inside the dentinal tubule in the layer of the forming dentin. During formation of the dentinogenesis, as I said before, first the secretion of the predentin happens. Here you can see it in the lower picture. This is the transmissional electronograph here. So here is the cell body of the odontoblast, and here is its odontoblastic process. This is the area of predentin, non-mineralized dentin, and in this picture, these two pictures, it is this area. And then mineralization happens. When mineralization happens, the crystals of so-called hydroxyapatite substance, it is the growing crystals of the calcium phosphates, they form first small round structures, and then these round structures grow and grow and grow. These round structures are called chalcospheroids, and while they grow, they fuse together and finally form the mineralized dentin. So in this area we have mineralization front, where the chalcospheroids first appear and grow and fuse together to form finally the mineralized dentin. It is seen here in this picture. And the process of the odontoblast stay embedded into the mineralized dentin, inside the dentinal tubules. So, while production of the dentin, first is produced the part of the dentin which is most closely to the enamel layer located. So here this line represents the dentin enamel junction. So everything which above, which is here, will be enamel. So here we have the border between the dentin and enamel, and this area, which is called mental dentin, it is the part of the dentin which is produced first. In this area, the collagen fibers go radially. These lines indicate the direction of the fibers in this area. These fibers, which are radially oriented, radially means like this, from the dentin enamel junction to the surface of the future tooth, like this. These fibers are called von Korff's fibers. Here they are. Next produced part of the dentin will be this lower part. It is called peripalpal dentin. Peripalpal because it surrounds and locates more closely to the pulp. Pulp will be here, where the odontoblast's bodies are located. In peripalpal dentin, the collagen fibers start to be oriented more horizontally, like this in this picture, but actually they go along the surface of the future tooth. They go as the surface of the tooth goes, and it is called tangentially. Tangential direction, which is parallel to the surface. So here we have the tangential collagen fibers, which are called 4 Ebner's fibers. And this area, which is called predentin, it is the newly produced material of the dentin, non-mineralized yet. And here we have the cell bodies of odontoblasts. They are located outside of dentin in the peripheral layer of the developing dental pulp, but now it is the dental papilla. So as a result, we will have the dentin, which includes the mantle layer with the radial von Korff's fibers, peripulpar layer with the tangential or von Ebner's fibers, predentin, very small area of non-mineralized dentin, most closely to the cell bodies of the odontoblasts. So in this picture we see the cell bodies of odontoblasts, and we see their apical processes which go towards the enamel dentin junction. These processes lie within the layer of the dentin inside dentinal tubules, and these processes are branching and they are interconnecting with each other. And some apical processes of odontoblasts grow into the layer of enamel. E stands for enamel here. So here some tips of the processes of odontoblasts are embedded into the enamel, and they will form the so-called enamel spindles, the areas of non-mineralized enamel. The process of the formation of dentin and enamel starts from the tip of the cusp of the tooth, from this area, and continues downwards. So this will be the first produced layer of dentin, this second, third, etc. And here will be the last produced layer of dentin. So at first, dentin in the crown region of the tooth is formed, and later the dentin in the root of the tooth is formed. Now the formation of the enamel or amelogenesis, it is produced by the cells which are called ameloblasts, which develop from the inner enamel epithelium of the enamel organ. So here are these cells marked with the red arrow. They stand upon the basement membrane, the white line in this picture. During cytodifferentiation in the Bell stage of enamel organ, these cells of inner enamel epithelium become pre-ameloblasts and then ameloblasts. Ameloblasts are elongated cells. After changing their polarity, the basal pole will look towards the stellate reticulum, from which these cells will receive nutrition. In this part of the cell, it will have rough endoplasmic reticulum, Golgi complex, and from apical pole, the Toms process grows. It is a small process through which the organic matrix of the future enamel is released, and also calcium and phosphate ions, which help enamel to be very fast mineralized. So major stages of amelogenesis production of enamel include matrix production or secretory stage. It is production of organic matrix, which is fast mineralized, and then matrix maturation. It means the removal of almost all organic materials and substitution of organic materials with calcium phosphate crystals, the crystals of hydroxyapatite. To discuss the process of the formation of enamel, we should say a few words about the structure of enamel. Enamel is composed of the so-called enamel rods or prisms that go through entire thickness of the enamel from dentin enamel junction to the enamel surface. Here you can see these enamel rods. Each enamel rod is elongated structure, so here is the cross-section of enamel rods. Each enamel rod in the cross-section has a keyhole shape. It has a head and the tail, and the tails of enamel rods are squeezed between the heads of adjacent enamel rods. Each enamel rod actually consists of elongated crystals of hydroxyapatite. Hydroxyapatite crystals are marked here as these black lines. So each enamel rod consists of elongated crystals, which run parallel to the long axis of the enamel in the each enamel rod in the head region and orthogonally in the tail region. So how this enamel prism is generated? So stages of amelogenesis start with the secretion of organic matrix, then its primary mineralization, then maturation of the enamel or secondary mineralization, and final maturation or tertiary mineralization. In the end, the mature enamel will contain up to 97–98% of hydroxyapatite crystals. So enamel will cover the crown of the mature tooth, and in its structure we will see the S-shaped enamel rods, these lines which go from the dentin enamel junction to the surface of enamel. So all enamel in the end consists of these enamel rods. Enamel has no cells because after production of enamel, the cells die with apoptosis, and enamel consists almost only from mineralized substance, from hydroxyapatite crystals. Only 2–3% is water and organic substances. So, first of all, the cells of the inner epithelium develop into ameloblasts, which are just elongated cells, and they produce an initial layer of aprismatic enamel. Aprismatic means it has no prisms in its structure. A means no. So the first layer, which is the most closely located to the dentin, consists of no enamel rods. Next, the cells enameloblast develop the Tomes process. Tomes process is triangular in shape. So here is the Tomes process of this ameloblast, and here is the Tomes process of the second one. And now when the ameloblast has Tomes process, it has the ability to generate enamel rods. So enameloblasts continue to produce organic materials, and first of all, the most proximal part of the Tomes process, this area marked with red color, produces the mineralized part of the enamel, which is called interprismatic enamel, red in this picture. And here also, and here also. So this will be first produced part of the prismatic enamel. It is called interprismatic or interrod enamel. It forms the structure like honeycomb, and inside each honeycomb the Thom's process of ameloblast is embedded. So this will be the interprismatic substance, and next the Thom's process, its distal portion, this one, produces the enamel rod itself, green in this picture. So in next stage, these honeycomb start to be filled with enamel rods. So enamel rods now are filling the mineralized matrix of the interrod region. Both interrod and enamel rods consist of these elongated crystals of hydroxyapatite. So crystals produced by the proximal portion of the Thom's processes are oriented perpendicularly to those produced by the distal portion of the Thom's process. So in interrod and rod region we have different orientation of the crystals. So ameloblast, here is its basal portion, and the apical Thom's process with its proximal portion and distal portion. Ameloblasts are connected together with junction, and first the interrod region is produced by the proximal portion of the Thom's process, and then the interrod region is filled with the enamel rods produced by the distal portions of the Thom's processes. And here you see how the Thom's processes release the substance which makes the enamel rod. So this is one ameloblast part, and here is the enamel rod produced by this cell. Here is second ameloblast, and here is its enamel rod. So at first the ameloblast has no Thom's process like this, and it produces the first layer of enamel, which is aprismatic enamel, this one, aprismatic enamel with no enamel rods, the most closely located to the dentin, brown in this picture. Next, the Thom's process grows in the apical portion of the ameloblast, and now it is able to produce prisms. And it starts to produce prisms and forms the enamel containing rods layer. Almost all the enamel in thickness contains enamel rods, and while the ameloblast produces its enamel rod, it moves in this trajectory. So these arrows indicate the path of movement of ameloblasts while they produce enamel rod. And so we have the shape of each enamel rod, also S-shaped. So here you can see the scanning electronogram of the enamel rods in human. They are S-shaped because of the shape of the path of the movement of ameloblasts. So while they produce enamel, they gradually move from the cells which produce dentin. So the cells which produce dentin, dentinoblasts, will stay here in this region, and they produce dentin. And in the end of the production of enamel, ameloblasts lose their apical process, produce the last layer of enamel, aprismatic enamel layer, and then they die. So when enameloblasts produce all the layer, all the thickness, all the layer of enamel, they die with apoptosis. So while they produce enamel, they release organic substances and also substances for very fast mineralization. So primary and secondary mineralization happens, and Then they die, and final maturation of the enamel or tertiary mineralization happens after eruption of a tooth, when ameloblasts are already dead. Actually, the last layer produced by the ameloblasts before they die is called the Naismith's membrane. It is the very thin layer of glycoproteins produced by the ameloblasts, and it will form the so-called primary cuticle, the layer which covers the enamel from outside. And secondary cuticle is the outer thick layer of the cuticle composed of the remnants of the outer enamel epithelium, which is here, and the remnants of the stellate reticulum. So they both combined form the very thin layer covering the enamel from outside, along with the Naismith's membrane produced by ameloblasts, and this cuticle covers the enamel, white in this picture, before tooth eruption. It serves for protection of enamel before tooth is erupted, and when the tooth goes into the oral cavity, the cuticle is shed away from this area, but it still is present in this area where the tooth is attached to the gingival epithelium. So this will be the area of the cuticle presence. Now here we see the next stage, the histogenesis of dental tissues. First, the tissues in the region of dental crown are formed, and only before the tooth is erupted, when the tooth goes into the oral cavity, only before this, the tissues of root of the tooth develop. So in our histological preparation, we see here the development of the crown of the tooth. The root of the tooth will develop later in this region. So what do we see here? We see here that the cells of the inner enamel epithelium became ameloblasts. Here you see these cells, and here they are in the histological picture. These cells produce enamel. Enamel, it is this thin layer, basophilically stained. So this basophilic layer is the enamel, produced by enameloblasts. The peripheral cells of the dental papilla became odontoblasts. Here they are, and here you can see them in the histological preparation. They produce dentin towards the enamel. So this area will be dentin. So enamel and dentin come in close contact together. Here is the dentin-enamel junction. And while production of dentin and enamel, ameloblasts and odontoblasts go further and further away from each other. Next, what became with other parts of enamel organ? Here you see the outer enamel epithelium, which in the area of the top of the crown comes very close to the ameloblasts. Here you can see it, outer epithelium, it comes very close to ameloblasts. Also here you see the intermediate layer, intermediate epithelium, and stellate reticulum, the pulp of enamel organ. They three partly degenerate in this area and form very thin layer, which will make the part of the cuticle of the tooth, covering the enamel of the tooth. In the lower region, we see here outer enamel epithelium and stellate reticulum. Intermediate epithelium should be closely located to the ameloblast. In this region, you see that in this area, the outer epithelium meets with inner enamel epithelium, and this will be called cervical loop. And in this area also, cervical loop will form the root of the tooth. In the center part, we see that dental papilla develops into the pulp of the future tooth. The pulp will be composed of loose fibrous connective tissue, so here mesenchyme of dental papilla develops into fibroblasts of loose fibrous connective tissue. Also, we have here a lot of blood vessels, and nerves also grow in this region from this area below. So, tooth histogenesis starts from the top of the crown and continues downwards, both for production of enamel and dentin. So, thickness of enamel and dentin gradually increases, and the ameloblasts and odontoblasts move away from each other. Outer enamel epithelium, together with collapsed stellate reticulum, will form the cuticle of the tooth in the region of the crown. And in the region of the forming root, the outer enamel epithelium meets inner enamel epithelium to form cervical loop, which will guide the root development. Intermediate layer of the enamel organ participates in calcification of enamel during its formation and also forms the cuticle of the tooth. The inner enamel epithelium forms enameloblasts in the crown region, which produce enamel, but the inner enamel epithelium do not turn into enameloblasts in the region of the root of the tooth, because root of the tooth should not contain enamel. Root should be covered with the cementum, not enamel. So in the root region of the future tooth, inner epithelium forms the cervical loop with the outer epithelium, which guides the root development. The peripheral cells of the dental papilla develop into odontoblasts, which form dentin both in crown and root region, first in crown, later in root, and all the rest of the dental papilla cells develop into connective tissue of the tooth pulp. And now let's look at the tooth root development. As I said, in the lower part, inner enamel epithelium meets outer one to form the cervical loop. So here in this diagram, you see the outer enamel epithelium here and inner enamel epithelium here. They form two-layered structure, which is called Hertwig's epithelial root sheath, or HERS for short. And this HERS grows downwards and downwards to form the shape of the future root. It grows between the mesenchyme of the dental sac, which is here outside of the tooth, and mesenchyme of the dental papilla, which is inside the tooth. As the HERS grows, the inner layer of the HERS promotes differentiation of the nearby dental papilla mesenchyme cells to turn into odontoblasts. So these mesenchyme dental papilla cells turn into odontoblasts, and they start to produce the dentin in the root of the tooth. After the dentin is formed, grayish line here, so this is the forming dentin of the root, the HERS disintegrates into separated small patches, small islets, called rests of Malassez, ERM. So here they are, rests of Malassez, which can be found in the periodontium. Next, they can give rise to the so-called cementicles, cysts, or tumors. So normally these epithelial roots of Malassez should fully disintegrate, but in some cases they remain and form some bad structures such as cementicles, cysts and tumors found in the periodontium of the root. But when normally these parts of the hairs disintegrate fully, then in this region outer mesenchyme cells of the dental sac come in contact with the odontoblasts of the root of the tooth, and this makes mesenchyme cells of the dental sac to become cementoblasts. And cementoblasts begin to produce organic matrix, cementoid, and form cementum of the root of the tooth. So as the result, we will have here in the inner area, we will have the dentin. Next, hairs will disintegrate, and the cells, mesenchyme cells in this region, will form cementum surrounding the dentin. So we'll have the dentin in the root of the tooth, which will be covered with the cementum. So hairs just guides the root formation, it describes the shape and the size of the root, but it is not included into the root itself normally. So the tissues of the root contain pulp, which develops from the dental papilla, dentin, which develops also from the dental papilla, and cementum, which develops from the dental sac. So all the tissues of the dental root develop from mesenchyme, not from epithelium. But epithelial cells can make bad substances, such as epithelial rests of Malassez, which can be found as these cysts or some other inclusions in the region of the periodontum of the tooth, if they are not fully disintegrated. So during the production of cementum, the cells, which are called cementoblasts, which develop from the dental sac, produce organic matrix, which is next mineralized. As you know, dentin and cementum are the types of bone tissues, so they develop like other types of bone tissues. First, cells produce organic substances with collagen fibers, and then next, crystals of hydroxyapatite attach to the collagen fibers and grow to mineralize the tissue. The root of the tooth has two types of cementum: acellular, which covers 2/3 of the tooth root. A means no, so acellular cementum contains no cells in the end of its formation. And second type is called cellular cementum. It covers 1/3 of the dental root at the top of the root in this region. It is thicker and it contains cells which are embedded into the hard extracellular matrix of cementum, and these cells are called cementocytes. Like osteocytes in the bone tissue, they are located in lacunae, from which canaliculi grow, inside which the processes of cementocytes go, and the processes of cementocytes come in the contact with each other, so cementocytes can receive nutrients and oxygen and other substances through these canaliculi. But unlike bone tissue, we have no blood vessels in the cementum, so all the nutrients should come here by diffusion through these small channels. And next, after the cementum is produced, then the periodontal ligament is formed. Periodontal ligament, it is here in this picture. It is dense, fibrous, regular connective tissue which attaches cementum of the tooth to the bone of the alveolus. So it has bundles of collagen fibers. It develops from the peripheral cells of the dental sac, where mesenchyme cells differentiate into fibroblasts, which start to produce procollagen molecules, and so collagen fibers are formed, and these collagen fibers are located one end inside the cementum and second end inside the alveolar bone. So they are called Sharpey's fibers. So one end in the cementum, second end inside the alveolar bone. So they attach the tooth into the alveolar socket in this bone. So we have two sources of development for all dental tissues: the epithelium of the oral cavity of ectodermal derailment and neuromesenchyme. The epithelium and mesenchyme have reciprocal induction. It means that epithelium acts upon mesenchyme cells, and mesenchyme cells in turn act upon epithelium, making each other to develop further into next structures. So epithelium develops into enamel organ, and in enamel organ, inner layer will make enamel. Outer and intermediate and stellate reticulum part of enamel organ will make just the cuticle of the tooth, which covers enamel before tooth eruption. Mesenchyme will make dental papilla and dental sac. Dental papilla makes dentin and the pulp of the tooth, and dental sac makes cementum and periodontum. Here is the same, and here is our histological preparation, named tooth development later stage, but actually this is the stage of histogenesis of the tooth, because here we see developing tissues of the tooth, namely enamel, blue line here, and dentin, red line here. Enamel is very fast mineralized, but dentin still has the area of non-mineralized pre-dentin, the white area more closely to the odontoblasts here. So here will be the region of the developing crown of the tooth. The root of the tooth is just starting to be developed, and here you see how the peripheral parts of the dental papilla develop into odontoblasts, which start to produce pinkish dentin in this region of the future root of the tooth. Here the cells of the dental sac will make cementum and periodontum, which will connect cementum to the bone, which develops here via direct osteogenesis. And here you see how the outer enamel epithelium meets the inner one to form cervical loop, which will guide the development of the root. Also here you can see the germ of the permanent tooth, which is present here along with the developing milk tooth. So the permanent tooth will develop in the same bony alveolar socket with the milk one. At high magnification, we see here the enamel, which is blue in color. It is produced by enameloblasts, elongated cells. Here you can see their cell nuclei. Here is their basement membrane. And here you see the apical Toms processes of enameloblasts, through which enamel is produced. This is enamel-dentin junction, and this is the dentin, pink in color because of collagen fibers. This lighter area is pre-dentin, which is non-mineralized dentin, produced by odontoblasts, which cell bodies are located at the periphery of the pulp of the tooth. But their apical processes, seen like light lines go through the entire thickness of the dentin towards the dentin-enamel junction. In this picture, the dentinal tubules with processes of odontoblasts are very well seen. So they go from the cell bodies of odontoblasts towards the dentin-enamel junction in this region. The same picture is here, and the same is here. The tip of the dental papilla, mesenchyme cells in the central part will make the loose connective tissue of the pulp of the tooth. Peripheral cells developed into odontoblasts, which are seen here. This is the pre-dentin, mineralized dentin, enameloblasts, and this is the forming cuticle of the tooth. It consists of outer enamel epithelium, a collapsed stellate reticulum, and intermediate epithelium. So the three are collapsed and they form a very thin layer of the future cuticle of the tooth. Everything which surrounds it is just the mesenchyme. So the same is here. And now here you can see the chart of the baby teeth. So this is the formula for the deciduous teeth, the temporary or milk teeth. They include 2 pairs of incisors in each jaw, canine teeth, 4 of them, and 2 molars in each side of the jaw. So 4 molars in each jaw, 8 molars overall. Here you can compare the teeth of a baby, the deciduous teeth and the permanent teeth. Unlike in baby, here in the adult we have the premolars and third molars in each part of the jaw. So if we look at the baby at 4, 5, 6 years old, he or she will have the milk teeth, which are seen in the mouth, in the oral cavity, and developed, not fully but developed, permanent teeth. They are now hidden inside the jaws, in the lower and upper jaw. The permanent teeth now have very well developed crowns, but not developed roots. Roots of the teeth develop only when the teeth start to be erupted. So if you look at the child at 5, 6 years old, he can have up to 52 teeth. 20 are seen in the oral cavity and others permanent are hidden inside the jaws. So how the permanent tooth is developing? It starts to develop from the same dental lamina closely to the developing germ of the milk tooth in the same socket. So in this picture you can see the lip of the baby, it's falling away milk tooth and the growing permanent tooth. So when the permanent tooth is erupted, what happens? At first, the milk tooth and permanent tooth developing in the same bony socket are separated with thin bony plate. But when the permanent tooth root starts to grow, it starts to push to this separation bony part between the permanent and milk tooth, and this bone starts to be resorbed by osteoclasts, then permanent tooth continues to push to the milk tooth, and it stimulates macrophages and monocytes of surrounding tissues to differentiate into osteoclasts, namely odontoclasts, that start to resorb dentin and cementum of the root of the milk tooth. So the size of the root of the milk tooth decreases, so the root of the milk tooth is almost totally destroyed. Periodontal ligament is also destroyed by macrophages, and the milk tooth falls away. As you see here, the milk tooth now, while it is falling away, consists only of its crown. No root is seen, because the root is eaten by the osteoclasts. And now permanent tooth erupts. We have 4 theories which explain why the teeth are erupted, how they do so. First theory um, tells about the dental root growth. It means that dental root starts to grow, it pushes to the bottom of the alveolus, and it causes the tooth to be erupted. The second theory is about the hydrostatic pressure inside the tooth region. So while the tooth root grows, it causes the increase of the hydrostatic pressure of the tissue in the root of the tooth, and this pressure pushes the tooth away from the bony socket. Third theory is the bone remodeling theory. It's about the consequence of alternating growth and resorption of the bottom of the alveolus. So this theory describes the cause of tooth eruption as the growing bottom of the alveolus. So the bone tissue grows and it pushes the tooth away. And the fourth one is the periodontal traction theory. It is about the developing periodontal ligament. Periodontal ligament is one end in the cementum and second end inside the bone tissue, and while the periodontal ligament develops, the length of the bundles of collagen fibers for some reason decreases, and because the direction of these fibers is not just parallel but at some angle like this, so when these bundles decrease in size, they kind of pushing the teeth a little bit away upwards. And also we have some dental development disorders based upon the disorders in different stages of development. If something bad happens during the stage of dental lamina and dental bud, we will have the numerical disorders, which is not normal number of the tooth germs and not normal number of teeth, because the number of teeth is equal to the number of dental buds. So we can have adontia, absence of teeth, because no dental buds developed. Hypodontia, like here, some teeth are missing because of no dental buds in these regions for some reasons. Oligodontia or hyperdontia, extra teeth. Like here, this is the extra tooth. Also, we can have germination. Here, it's kind of twin tooth. One dental bud gave 2 teeth. And fusion, when we had 2 teeth but they fused together. These 2 types may look very similar to the dentist, but in the first case, the structure we will have only one root canal. But if you have the fusion of two teeth, they will have two different root canals. And it is very important in clinical practice for the dentists. If some bad happened in the stage of the enamel organ, we will have the disorders of the size of the tooth. For example, microdontia, two small teeth like this one, or macrodontia, two large teeth like these. If the disturbance happened in the stage of histogenesis, we will have the disorders of the shape and structure of the tissues of the tooth. For example, the non-normal development of the dentin, like dentinogenesis imperfecta here, or not good development of the enamel, like enamel hypoplasia or amelogenesis imperfecta. If we have the disturbances in the stage of the root formation, we can have the taurodontism. This is the normal tooth, and different stages of taurodontism. It is too short roots and too large pulp chamber. Also, we can have the hypercementosis if we have too much cementum, or we can have accessory roots. It is also very bad for treatment of the teeth and for surgery. And also we can have the eruption and exfoliation disorders, such as premature eruption, delayed eruption, premature exfoliation, and delayed exfoliation. So, that's all for today. Thank you for your attention. See you in class. Goodbye.